We all know we should brush our teeth to prevent cavities.
So what is a cavity? A cavity is a tiny hole in a tooth, or at least when it first starts. Cavity is also known as tooth decay, caries, and dental disease. Cavities are what happens to a tooth when we don't take care of our mouth consistently with daily brushing and flossing to remove the acid and bacteria found in dental plaque. In this video, we're going to talk about what is a cavity, what causes a cavity. If you don't have pain, how do you know you have a cavity? What happens when you get a cavity? How do you get help for a cavity? And how do you prevent cavities?
My name is Sherry Wertz. I'm a mom, a registered dental hygienist, an oral facial myologist, an oral health coach, a burst ambassador, author, and speaker. When you look at the way we actually take care of our mouths, it would seem oral health is unimportant. Cavities have become so common these days, we consider it a normal part of growing up. So much so, it's the #1 preventable disease among our children in the US. That's what I said. Cavities is a disease. I've been in the dental field for over 30 years, and even I didn't see it until I got divorced and started working in a mobile dental company, where we went to schools and saw 20 to 60 children a day. As a dental hygienist, I thought I was focusing on prevention, seeing patients twice a year, and helping them prevent disease in their mouth. It became very apparent to me we've been focusing on the wrong things.
We saw kids that not only had 1 or 2 small cavities, they had multiple cavities that were so big we didn't even need x-rays to see them, and they were missing days of school due to toothaches and pain. You have a cavity is not what anyone wants to hear. A cavity develops when plaque is allowed to sit on a tooth, and we feed it with the foods and sugars that we eat all day long. It weakens the enamel and creates an acid. It's that acid combined with the plaque and bacteria that create the hole in your tooth. That's why brushing is so important morning and night, to stir up that plaque and bacteria and acid so it can't weaken the enamel and cause a cavity. So this is the progression of a cavity. It starts in the enamel of the tooth, which is the hard outer layer, then the dentin, then it gets into the pulp, and eventually the blood nerves, and you need a root canal. So when the plaque accumulates on the top of the tooth, if you don't brush it off, it creates a cavity. While it's still in the enamel, it is reversible. But once that cavity gets into the dentin, which is the soft layer of the tooth, you need to have a filling. If you wait too long to have a filling, that cavity progresses into the pulp of the tooth and damages the nerve, which then you need a root canal. So we eat all day long. And when we snack in between meals, we don't give our tooth a recovery period. And that acid is in our mouth. And it's really the acid that causes decay. So that's why controlling the pH of our mouth is really important, and making sure that we watch what we eat and we don't eat a lot of sugary, acidic foods. So how do you know you have a cavity? You need to see a dentist. A dentist will look in there with a light and a mirror and see what's going on. Sometimes you can see a cavity when you just look in there, but most of the time you need x-rays, especially when it's small and just in the enamel layer of the tooth. So when you take x-rays at a dentist to look for cavities, you take what's called bite wing x-rays. So you can see in between each individual tooth to see if there's a cavity happening. So these x-rays show no cavities on baby teeth and a couple of permanent teeth. These are permanent teeth that show a cavity that's happening in between, which is called interproximal, that you can see on an x-ray. Sometimes if you can't get x-rays, you can use a tool called a caries view. A caries view shows you a cavity from the top of the tooth, and where the light doesn't shine through, that is a cavity. There's no mistaking when it goes through the dentin layer of the tooth, and you can see it on this picture. So what happens when you have a cavity? A lot of times when cavities are in between the teeth, what happens is it's not only on one tooth, it's on both teeth on each side. So hopefully you get the cavity soon enough that it only affects one and not both, but you need to see a dentist so they can fill it. If the cavity is too big, or you have an abscess in the tooth and you can see the abscess from the outside and the swelling from the inside, you're probably going to need to get that tooth extracted. So how do you prevent cavities? First, by eliminating bad habits. And a lot of people don't check to see where they're missing and if they're getting all the plaque off. So I recommend using disclosing. It stains the plaque to see where you're missing. That invisible plaque. Where it's pink in this picture, it's only been there for a day. Where it's purple, it's been there for 2 to 3 days. And when it starts to turn blue, that is actually acid-producing bacteria. When you don't brush this off, and once you get it brushed off, it looks white below there, and that's where the tooth has been weakened, and it's called decalcification, and that's where you need fluoride or other products to recalcify the enamel. If you'd like more information, check out my other YouTube videos. Water is another great way to control the pH of your mouth and reduce cavities. Our bodies are made of 60 to 70% water, and water has a neutral pH already on its own. That is tap water. You might have to test bottled waters, but swishing or drinking it throughout the day definitely will help reduce cavities. Brushing your teeth 2 minutes twice a day is another way that I recommend to help control plaque and bacteria in your mouth. You actually have to get in there and disrupt it. Kids usually only brush the fronts of their teeth. So I recommend as a parent you go back in and brush your kids' teeth. If you're in a time crunch, at least brush the outsides of the uppers and the insides of the lowers, because that's where kids miss on their own. And I recommend using disclosing because it's a fun experiment. It makes toothbrushing fun and creates memories that last a lifetime that your kids can pass on to their kids and create good oral health memories. Another thing you can do to reduce the Streptococcus mutans that cause cavities is use products with the first active ingredient, xylitol, gum or candy. If you chew gum that has the first active ingredient, xylitol, 3 times a day for 5 to 10 minutes, it will not only control and reduce cavities in your mouth, it can control and reduce cavities in your kid's mouth.
The American Dental Association recommends you brush twice a day with a soft bristled toothbrush, the size and shape that fits your mouth, to get to all the areas easily. It also recommends you floss daily and use a fluoride toothpaste. However, fluoride is not for everyone. And if you're brushing, rinsing, and spitting, fluoride's not on your teeth long enough for it to even be a benefit. But there are instances where you need fluoride and what you can do for the fluoride to be on there longer, and we'll talk about that in another video. The proper technique is to place your toothbrush at a 45-degree angle along the gum line, gently moving back and forth in long and short, wide strokes. If you're using a manual toothbrush, I kind of recommend circular rather than back and forth because some people get a little too aggressive with their toothbrush and they can do more harm than good. You need to brush the outer surface, the inner surface, and the chewing surface, cleaning all of these surfaces until you get all the plaque off, along the gum line and on the teeth. Having mentors and being part of a community that can encourage and support you is one of the most important things you can have to reach your health goals. I would love to help you along the way. I have a 7-day toothbrushing challenge where we talk about toothbrushing the proper way, flossing, what's right for you, tongue health, sanitizing your toothbrush, and so much more. Click the link below if you'd like to know more about that. And thanks for watching. If you like this video, hit the thumbs up, comment below, and subscribe for more weekly videos.